All right, so get ready because today
Yeah.
we're diving into the world of healthcare policy.
Sounds exciting.
You guys sent us a chapter from the book, Mandate for Leadership, The Conservative Promise.
Yep.
And, well,
It's a big one.
it's a long one. It's all about reshaping, restructuring, kind of reimagining the U.S. Department of Health and Human Services.
HHS.
Yeah,
A
HHS.
very impactful department.
Huge, right?
Yeah.
So
Yeah.
we're going to break it all down, try to figure out what are the main ideas here. What could this mean for, for us,
Yeah.
the everyday person?
This chapter is basically like a blueprint for a conservative vision of what HHS should look like.
Okay, so right off the bat,
Yeah.
this chapter, they throw out some pretty big numbers.
They do.
Like, did you know
Yeah.
if HHS was like its own country,
Right.
it would have the 5th largest budget in the world?
It's massive. It shows you just how much influence this department has
It's huge.
in our lives and in healthcare.
Yeah, and they argue that maybe that influence
Right.
hasn't always been used in the best way possible.
Exactly.
They point to,
Well, sorry, go ahead. They bring up the fact that U.S. life expectancy has actually declined.
oh, wow.
And they argue that this is connected to the Biden administration's focus on equity for specific groups,
Okay.
which they contrast with the Trump administration's more general approach, which they describe as serving Americans from conception to natural death.
So they're kind of drawing a line
Yeah.
between those two approaches.
Definitely. And saying that this shift in focus
Okay.
has actually had negative consequences for the health of Americans overall.
Huh. So focusing on certain groups has actually led to, like, worse outcomes overall.
That's what they're arguing.
Okay. Interesting.
And to fix what they see as this problem,
Okay.
they propose 5 main goals for reforming HHS, which they call the 5 pillars of reform.
Ooh, 5 pillars. All right. Lay them on me.
All right, here they are.
Okay.
Protecting life, conscience, and bodily integrity.
Okay.
Empowering patient choices and provider autonomy.
Got it.
Promoting stable and flourishing married families.
Okay.
Preparing for the next health emergency.
Right.
And instituting greater transparency, accountability, and oversight.
Wow. So those are some,
They're pretty broad.
some pretty big goals. A lot to unpack there.
A lot to unpack, and each of these is then applied to different agencies within HHS
Okay.
to see how they could be reshaped to achieve those goals.
So where do they start? Like, what's the first agency they tackle?
Well, let's start with one that everyone's familiar with, the Centers for Disease Control and Prevention,
CDC.
or the CDC as most people know it.
The CDC. Yeah, they were kind of front and center during the COVID-19 pandemic.
Right.
And this chapter, well, it doesn't exactly paint them in a positive light, does it?
Not really. They're pretty critical of how the CDC handled the pandemic.
Like, what specifically are they
Well, they point to
pointing to?
the constantly changing guidance on masks.
Oh, yeah, I remember that.
The delays in testing, the whole 2 weeks to flatten the curve thing,
Yeah, those 2 weeks turned into a lot longer than 2 weeks.
a lot longer.
So what's their solution? Like, do they want to just fire everyone at the CDC and start over?
Not quite,
Why?
but their proposal is still pretty radical.
Okay, I'm intrigued. What is it?
They want to split the CDC into 2 separate agencies.
2 CDCs.
2 CDCs.
Okay, how would that even work? Like, what would each one do?
So one agency would be completely focused on data,
Okay.
collecting it, analyzing it.
So like the research arm.
Yeah, you could think of it that way.
Okay.
And here's the really interesting part. They would be legally required to publish all their findings.
All of it.
All of it. Making all that data completely transparent and accessible to the public.
Whoa, that's a big change.
A huge change. So like researchers, scientists, anybody could just get their hands on that raw data.
That's the idea.
I mean, that could lead to some pretty amazing breakthroughs, right?
Potentially.
But couldn't it also be kind of dangerous? Like, what if people misinterpret the data? That's a valid concern.
Yeah.
And it's one that the chapter acknowledges.
Yeah.
But they argue that the benefits of transparency outweigh the risks.
So they're saying that more information is always better,
Essentially, yes.
even if it means that some people might misuse it.
They believe that an informed citizenry is a key part of a healthy democracy.
Interesting. Okay, so one CDC for data. What about the other one? What would they focus on?
The second agency would be responsible for developing public health recommendations.
Okay.
But, and this is important, they would have very limited power to actually enforce any policies.
So more like advisors than rule makers.
Exactly.
Interesting.
They argue that this would prevent overreach and ensure that public health recommendations are based on science, not politics.
Okay, so a pretty big shakeup at the CDC.
Yeah.
What about some of the other major players within HHS? Like, what about the FDA?
Oh, the FDA, yeah, they definitely don't get a free pass in this chapter either.
What are their issues with the FDA?
Well, they're very critical of what they see as the FDA being too cozy with big pharma.
Okay, so they think they're too friendly with the pharmaceutical industry.
Yeah, and that this leads to practices that stifle competition and keep drug prices high.
So they basically want to make it easier for generic drugs to enter the market and compete with the brand name drugs.
That's a big part of it.
Okay, and I imagine they also have something to say about the whole drug approval process.
Oh, absolutely.
Like they probably think it's too slow and bureaucratic.
Exactly. They want to see it streamlined, especially when it comes to the approval of new medical tests.
Okay, so speed things up, make it easier for new treatments and diagnostic tools to get to the people who need them.
That's the goal.
But doesn't that also raise some concerns about safety? Like if you're rushing things through, couldn't that potentially put people at risk?
That's a valid point, but they argue that the FDA has become overly bureaucratic and risk-averse, and that it's possible to streamline the process without sacrificing safety.
Okay, so they're saying that you can be both efficient and safe.
Yes, they believe that the current system is too focused on preventing any potential risk, even if it means delaying access to potentially life-saving treatments.
Okay, so a more efficient, less burdensome FDA. But I have a feeling they also have some very specific targets in mind, right?
You are correct. One of their most controversial proposals is aimed at abortion pills.
Ooh! Okay, this is where things are going to get interesting. I can feel it.
It's definitely a hot button issue.
So what do they have to say about abortion pills? What do they want to do?
Well, they call abortion pills the single greatest threat to unborn children in a post-Roe world.
Wow, that's a pretty strong statement.
It is, and they want to see a complete reversal of FDA approval for these drugs.
You completely get rid of them.
That's their ultimate goal.
I mean, I can already hear the outcry from pro-choice advocates.
Oh, absolutely. This is a proposal that would be met with a lot of resistance.
So what's their reasoning behind this? Why are they so opposed to abortion pills?
They argue that the initial approval process for these drugs was flawed and ignored safety concerns.
Okay, so they're saying that they were rushed through without proper vetting.
Essentially, yes. And as an interim step, while they're working toward a complete reversal of approval, they call for reinstating in-person dispensing requirements.
So no more getting them through the mail or telehealth.
Right, they want to make it more difficult to access these pills.
And I imagine they also want to see stricter reporting of any adverse events or complications.
Absolutely. They want more data on the potential risks and side effects of these drugs.
Okay, so a pretty significant crackdown on abortion pills. It's a move that would definitely have a major impact on reproductive health care in this country.
Yes, there's no doubt about that. It's a highly charged issue with far-reaching implications.
It is. Okay, so we've got a potentially divided CDC and a possibly reformed FDA. What other agencies are in for a makeover, according to this chapter?
Well, they don't stop there. They also have some strong opinions about the National Institutes of Health, the NIH.
The NIH, okay, that's the big one for medical research, right?
Exactly. They're the primary agency responsible for funding medical research in the United States.
And they have a massive budget, I imagine.
Huge budget, billions of dollars.
So what's the issue? Are they saying that the NIH is wasting taxpayer money?
Well, they argue that the NIH hasn't always been the best steward of those funds.
Okay, like what specifically are they pointing to?
Well, for one thing, they're concerned about potential conflicts of interest.
Conflicts of interest, like what, researchers having financial ties to pharmaceutical companies or something?
Exactly. They argue that researchers shouldn't be personally profiting from the outcomes of their research, especially if it involves companies that stand to gain financially.
Yeah, that does make you wonder about objectivity, right? Like, is the research truly being conducted in the public interest, or is there a bias towards whatever's going to make the most money?
That's their concern.
And I remember there was that whole controversy with Dr. Fauci and those royalty payments, right?
Yes, and the chapter uses that as an example of why they believe stricter conflict of interest rules are needed.
Okay, so that's one issue. Are they only concerned about financial conflicts of interest, or is there more to it?
There's more. They also take issue with what they call woke policies at the NIH.
Woke policies. Okay, I'm curious. What do they mean by that?
Well, for example, they criticize things like conference quotas for women speakers and funding for research on gender identity.
So they're saying that the NIH is too focused on social issues and not enough on hard science.
That's their argument, yes.
Interesting. And what kind of research do they want to see the NIH prioritize instead?
They want to see a greater focus on research that benefits the broadest possible segment of the population.
Okay, that makes sense.
So, for example, they advocate for finding alternatives to using fetal tissue in research.
Oh, that's a big one.
It is, and they
Hmm.
also want to see more research on the potential harms of cross-sex interventions.
Okay, well, those are definitely hot-button issues that are likely to spark debate.
Absolutely. These are very sensitive topics with strong opinions on both sides.
No doubt about it. All right, so we've got a potentially split CDC, a streamlined FDA, and now a refocused NIH. What's next on their agenda for reforming HHS?
Now we get to the really big ones: Medicare, Medicaid, and Obamacare.
Ooh, the heavy hitters. Those are massive programs that affect millions of Americans.
Ah, millions, and they're incredibly complex.
Oh, yeah, just trying to understand how they work can make your head spin.
It's true, but in essence, this chapter advocates for a major shift towards patient-centered, market-based solutions.
Okay, so in plain English, what does that actually mean for people who rely on these programs?
It means giving patients more control over their healthcare dollars and encouraging competition between providers.
Okay, so more options, more freedom to choose, but wouldn't that also put more responsibility on individuals to navigate a very complicated system?
That's a valid point, and it's something that would need to be addressed.
Yeah, because not everyone has the time or expertise to become a healthcare expert.
Exactly.
So how do they propose to help people make informed choices in a more market-driven system?
They argue that greater transparency in pricing and quality would be key.
Okay, so being able to easily compare costs and quality ratings between different providers and plans.
Right.
That makes sense. Okay, and what about Obamacare? What do they propose to do about the Affordable Care Act?
Well, they're not big fans of the ACA.
I imagine not, given the source material.
Right, and they propose separating the subsidized and unsubsidized markets.
Okay, and what would that achieve?
Well, it could potentially lower costs for those who don't qualify for subsidies,
Okay, that sounds good.
but it could also lead to some people losing coverage or having to settle for less comprehensive plans.
Ah, so there's a trade-off.
There always is in healthcare.
Yeah, it seems like you can't make one group better off without potentially making another group worse off.
It's a delicate balance.
It is. Okay, so we've covered some pretty big agencies: CDC, FDA, NIH, and now Medicare, Medicaid, and Obamacare.
And we're just getting started.
There's more. This chapter really goes deep, doesn't it?
It goes into a lot of detail about the inner workings of HHS and all the different offices and programs within the department.
Wow. Okay, well, I'm ready for more. Let's keep diving in.
All right, let's do it. Let's talk about the Administration for Children and Families, or ACF.
The ACF, okay, I'm not as familiar with that one. What do they do?
They're responsible for a wide range of programs that support families and children.
Okay, like what kind of programs?
Things like Head Start, child care assistance, child support enforcement, and programs that address child abuse and neglect.
Okay, so pretty important stuff.
Very important.
And what kind of changes do they want to see at the ACF?
Well, one interesting idea they put forward is establishing a child support tax credit for non-resident parents.
A tax credit for child support. That's a new one.
It is, and it's kind of a controversial idea.
So how would it work?
The idea is to provide a financial incentive for non-custodial parents, typically fathers, to stay involved in their children's lives and contribute financially.
So it's not just about collecting child support payments, but encouraging a more active role in parenting.
Exactly.
Interesting. And do they have any other ideas for how to strengthen families and promote responsible fatherhood?
They also want to see TANF funds, which are typically used to support low-income families, directed towards programs that promote healthy marriages.
Okay, so a tax credit to incentivize involved fatherhood and a focus on marriage.
Right.
It seems like they're really emphasizing the importance of traditional family structures.
Yes, that's a recurring theme throughout this chapter.
Interesting. Okay, what other programs within the ACF do they address?
They also delve into teen pregnancy prevention and adoption.
Okay, two very important and often controversial topics. Let's start with teen pregnancy prevention. What are their thoughts on that?
They want to see a greater emphasis on sexual risk avoidance programs.
Sexual risk avoidance, so like abstinence-only education.
Essentially, yes.
Instead of comprehensive sex education that includes information about contraception.
Right.
Okay, and what's their reasoning behind that?
They believe that abstinence is the safest and most effective way to prevent teen pregnancy and STDs.
Okay, and what about adoption? What are their thoughts on that?
They want to make it easier for faith-based agencies to participate in the adoption process.
Even if those agencies have policies that some might consider discriminatory. Like, if an agency refuses to place children with same-sex couples because of their religious beliefs.
Yes, even in those cases.
Okay, that's a controversial stance for sure. How do they justify that?
They argue that religious liberty should be protected in these situations,
Okay.
and that maximizing the number of available adoptive families, even if some have restrictions, is ultimately in the best interests of children waiting to be placed in loving homes.
So it sounds like this chapter is really trying to bring faith and traditional values back into the equation when it comes to HHS policies.
Yes, I think that's a fair assessment.
Okay, so we've covered families, children, and teens. What other areas within HHS do they tackle?
Well, they also address the government's role in emergency preparedness.
Emergency preparedness. Oh, like in the context of the COVID-19 pandemic.
Exactly. They argue that the federal response to the pandemic was overly heavy-handed.
Okay, so they're saying that the government went too far with things like lockdowns and mask mandates.
Yes, and vaccine requirements as well.
Okay, and what's their alternative? What do they think the government should have done differently?
They believe that these measures were ineffective and ultimately did more harm than good.
That's a pretty bold claim.
It is, and they want to see stricter limits on the government's ability to declare public health emergencies.
So less power for the federal government and more autonomy for individual states.
Exactly.
Interesting. And do they have any specific proposals for how to improve emergency preparedness in the future?
Yes, they want to see reforms to the Strategic National Stockpile.
The Strategic National Stockpile, that's the nation's reserve of medical supplies and equipment, right?
Exactly.
And what kind of reforms do they have in mind?
They want to ensure that it's better stocked and more readily available in the event of future pandemics.
Okay, so being better prepared for the next crisis.
That's the goal.
Okay, so we've got a smaller federal role in healthcare, more individual liberty, and a greater emphasis on traditional values.
Yes, those are some of the key themes that emerge from this chapter.
It's a pretty significant departure from the current direction of HHS.
It is, and it's certainly a thought-provoking vision.
It is. Okay, so we've covered a lot of ground here.
We have, but this chapter goes into even more detail about the various offices within HHS.
There's more. We haven't even scratched the surface, have we?
Not really.
Okay, well, I'm ready to dive deeper.
Let's do it.
Lead the way.
All right, let's start with the Office of General Counsel, or OGC.
The OGC, what do they do?
They provide legal advice to HHS, interpreting laws and regulations and helping the department navigate legal challenges.
Okay, so they're like the legal team for HHS.
Exactly.
And what do they have to say about the OGC?
They're critical of what they see as the OGC being overly cautious.
Overly cautious, like what do you mean?
They argue that the OGC has issued legal opinions that have expanded the scope of government power and restricted individual liberty.
Okay, so they want to see a more conservative legal approach from the OGC.
Yes, one that aligns with their principles of limited government and individual freedom.
Interesting. Okay, and they also talk about the Office of Global Affairs, right?
Yes, that's another office they focus on.
And what does that office do?
The Office of Global Affairs plays a role in shaping America's global health policies.
Okay, so like working with other countries on health issues.
Exactly. Things like combating infectious diseases, promoting maternal and child health, and responding to global health emergencies.
Okay, and what do they want to see from the Office of Global Affairs?
They believe it should have a more prominent role.
A more prominent role, like what? More funding? More staff?
Well, they actually advocate for elevating the director's title to Assistant Secretary.
Assistant Secretary, so a more senior position within the department.
Exactly. They believe that would give the office more clout on the international stage.
Okay, and what kind of policies do they want this office to be promoting globally?
Well, one thing they emphasize is a strong pro-life stance.
Pro-life, so they want the Office of Global Affairs to be actively working to restrict abortion access around the world.
That's correct.
I imagine that would generate some controversy.
Oh, definitely.
Not every country shares those views.
No, but they argue that this position represents America's true values and should be front and center in our global health diplomacy.
It's a bold vision, for sure.
It is.
And whether or not you agree with it, it's definitely something that would shake things up on the world stage.
Absolutely.
Okay, any other offices they cover?
One last one.
Okay, hit me with it.
The Office for Civil Rights, or OCR.
The Office for Civil Rights, what do they do?
They're responsible for enforcing federal laws that prohibit discrimination in healthcare settings.
Okay, so making sure that everyone has equal access to health care, regardless of their race, religion, gender, or other protected characteristics. So they're concerned about discrimination in healthcare? That seems like a good thing, right?
Well, they argue that the OCR has strayed from its core mission.
Strayed from its core mission, how so?
They believe that the OCR has become too focused on advancing what they call a radical social agenda.
A radical social agenda. Okay, I'm intrigued. What specifically are they talking about?
They criticize the OCR's efforts to expand protections for transgender individuals.
Okay, so they're not on board with those efforts.
No, they're not.
And what else?
They also criticize the OCR's enforcement of the Affordable Care Act's non-discrimination provisions.
Okay, those provisions are meant to prevent discrimination based on things like pre-existing conditions and gender, right?
That's right. But they argue that these provisions have been used to force healthcare providers to violate their conscience or religious beliefs.
Okay, so they're basically saying that the OCR is infringing on religious freedom in the name of preventing discrimination.
That's their argument.
Wow, so it sounds like they want to see a pretty significant rollback of the OCR's authority.
Yes, they want to see a more limited role for the OCR, one that focuses on traditional civil rights concerns and respects religious freedom.
Okay, so we've covered a lot of ground here.
A lot of ground.
This chapter is like a blueprint for a conservative vision of healthcare in America.
It really is.
It's a radical reimagining of HHS from top to bottom,
A complete overhaul.
and it's sure to spark a lot of debate.
Oh, absolutely. There are strong opinions on both sides of these issues.
No doubt about it. So as we wrap up this segment of the deep dive, I'm left wondering, what would it actually look like if these proposals were implemented?
That's the big question, isn't it? What would be the practical implications for everyday Americans?
And what are the potential benefits and drawbacks of such a dramatic shift in healthcare policy?
Let's explore those questions further in our final segment. It really makes you think, doesn't it? Like, how would all these changes actually play out in the real world?
Yeah, that's what I'm wondering. Like, what would it mean for, for people who actually rely on these programs for their healthcare?
Right, like, would their lives get better or worse?
Exactly. And are there any unintended consequences that we're not even thinking about?
It's hard to say for sure, but I think it's safe to say that there would be some pretty significant shifts in the healthcare landscape.
Okay, so let's try to break it down a little bit. Like, let's start with this idea of a more market-driven approach to healthcare. What would that actually look like for patients?
Well, in theory, it could mean more choices and lower costs.
Okay, that sounds good.
The idea is that by increasing competition between providers and giving patients more control over their healthcare dollars, you create a more efficient and affordable system.
So kind of like how we shop for other goods and services. Like we compare prices, we look for the best value.
Exactly. And they argue that the same principles should apply to healthcare.
Okay, I can see the logic there, but I also worry about people who might not have the resources or knowledge to navigate a more complex system. Like, what about people who are elderly or have chronic illnesses? Would they be able to handle all that extra responsibility?
That's a valid concern, and it's something that would need to be addressed if we were to move towards a more market-driven system.
Yeah, because it's already hard enough for a lot of people to understand their healthcare options and make informed decisions.
Right, and if you add more choices and more complexity, it could make things even more confusing and overwhelming for some people.
Exactly. So I think it's important to consider those potential downsides as well, not just the potential benefits.
Definitely. It's about finding a balance.
Okay, and speaking of sensitive topics, let's talk about reproductive health care, because this chapter makes it pretty clear that they want to restrict abortion access.
Yes, they do. That's a central part of their vision for HHS.
So what would that mean in practice? Like, would abortion become illegal in certain states or nationwide?
Well, they don't explicitly call for a nationwide ban on abortion, but they do advocate for policies that make it more difficult to access abortion services.
Okay, like what kind of policies are we talking about?
Well, we've already talked about their proposal to reverse FDA approval for abortion pills.
Right, so that would make it much harder for women to obtain those pills.
Exactly. And they also want to see a defunding of Planned Parenthood.
Planned Parenthood, that's a major provider of reproductive health care services, including abortion.
Yes, and they argue that taxpayer dollars should not be going to organizations that provide abortions.
Okay, so less access to abortion services, and I imagine they also want to see more support for alternatives to abortion, like adoption.
Yes, they do. They believe that HHS should actively promote adoption as a positive alternative to abortion.
Okay, so a pretty significant shift in how we approach reproductive health care.
It would be a major change, and one that would likely be met with a lot of resistance from pro-choice advocates.
Yeah, I can't imagine that going over very well with a lot of people.
It's a highly divisive issue.
It is, and
Yeah,
it's one that we could probably spend an entire episode talking about.
easily.
But for now, let's move on to another big theme that emerged from this chapter, the emphasis on traditional family values.
Ugh, right, that's a key part of their vision for HHS as well.
So what does that mean in practice? Like, what kind of policies would they implement to support traditional families?
Well, we've already talked about their proposal for a child support tax credit for non-resident parents.
Right, and that's aimed at encouraging fathers to be more involved in their children's lives.
Exactly. And they also want to see TNF funds directed towards programs that promote healthy marriages.
So basically using government money to encourage people to get married and stay married.
That's the idea. They believe that strong, stable families are the foundation of a healthy society.
And that those families should ideally consist of a married mother and father.
Yes, that's the model they're promoting.
Okay, and are there any other policies they would implement to support this vision of traditional families?
Well, they also talk about the importance of sexual risk avoidance education.
Right, we talked about that earlier. That's the abstinence-only approach to sex education.
Exactly. They believe that teaching young people to abstain from sex until marriage is the best way to prevent teen pregnancy and STDs.
Okay, so a pretty conservative approach to sex education.
Yes, it is.
And then there's the whole issue of faith-based organizations. Like, they want to see those organizations play a bigger role in social services.
Yes, they do. They believe that faith-based organizations are well-positioned to provide support and guidance to families.
Even if those organizations have policies that discriminate against certain groups, like LGBTQ plus individuals or unmarried couples.
That's a point of contention because they argue that religious freedom should be protected, even if it means that some people might be excluded from certain services.
Okay, so that's a pretty controversial stance.
It is, and it raises a lot of difficult questions about the balance between religious freedom and non-discrimination.
Yeah, it's a tough one.
It is.
Okay, so we've got a lot of changes aimed at promoting traditional family values.
Right.
And all of this is happening against the backdrop of a smaller federal role in healthcare.
Exactly. They want to see a shrinking of the federal government's involvement in healthcare.
So less government spending on things like Medicare and Medicaid.
Yes, and a greater reliance on private sector solutions.
Okay, so more individual responsibility, less government intervention.
That's the general idea.
It's a pretty dramatic departure from the current system.
It is, and it would have far-reaching implications if it were implemented.
Okay, so let's try to wrap our heads around all of this. Like, if all of these changes actually happened, what would be the overall impact on the U.S. healthcare system?
Well, that's the million-dollar question, isn't it? And it's one that's difficult to answer with certainty.
Yeah, there are so many variables, so many potential outcomes.
Right, but I think it's safe to say that it would be a very different healthcare system than the one we have today.
Okay, so different, but would it be better? Like, would it actually improve the health and well-being of Americans?
That's the ultimate question, isn't it? And unfortunately, there's no easy answer.
Yeah, I was afraid you were going to say that.
Because there are potential benefits and potential drawbacks to both approaches, the more government-centered approach and the more market-driven approach.
Right, so it's not a simple matter of one being good and the other being bad.
Exactly. It's much more nuanced than that.
Okay, so where does that leave us? Like, how do we even begin to make sense of all of this and figure out what the best path forward is?
Well, I think it starts with having open and honest conversations about our values and priorities.
Okay, so talking about what kind of healthcare system we want as a society.
Right, and what we're willing to sacrifice to achieve those goals.
Because it seems like every choice comes with trade-offs.
It does. There's no such thing as a perfect solution.
Yeah, no magic bullets in healthcare.
Unfortunately not.
Okay, so more conversation, more deliberation, and hopefully at the end of it all, we can come to some kind of consensus on how to move forward.
That's the hope, because healthcare is such a fundamental part of our lives. It affects everyone.
It does, and it's something that we need to get right.
Absolutely.
Well, I think this chapter has given us a lot to chew on, a lot to think about.
It has. It's a very thought-provoking piece.
It is. And even if you don't agree with everything they say, I think it's important to understand these perspectives and engage with these ideas.
I agree, because these are the kinds of conversations that we need to be having as a society.
Absolutely. Well, we've covered a lot of ground in this segment, but there's still more to explore.
There is. We haven't even touched on all the implications of these proposed changes.
Right, like what would this mean for the future of healthcare innovation, for access to care in rural areas, for the cost of prescription drugs?
So many questions still to be answered.
Exactly. So many layers to peel back.
Well, I'm ready to keep peeling.
Me too. Let's dive into those questions in our final segment.
All right, so we've spent a lot of time unpacking this conservative vision for HHS.
It's a pretty radical reimagining, isn't it?
It is a lot of big changes.
Yeah, and I think a lot of people are probably wondering, like, what would this actually look like in real life? If all these proposals were actually implemented.
Right, like how would it affect people's day-to-day lives?
Exactly.
Well, if we try to imagine healthcare in America under this vision,
Okay.
I think one of the biggest changes you would see is a much more market-driven approach.
So less government involvement, more emphasis on, patient choice and competition.
Exactly. The idea is that by creating a more competitive marketplace for healthcare, you would drive down costs and improve quality.
Okay, and that sounds good in theory, but I also worry about, the potential downsides.
Right.
Like, what about people who might not have the resources or knowledge to navigate a more complex system?
That's a valid concern, and it's something that would need to be carefully considered.
Yeah, because if you're already struggling to afford healthcare, having more choices might not actually be helpful if you don't have the information or support to make informed decisions.
Exactly.
And then there's the whole issue of, access to care in rural areas or for people with pre-existing conditions. Like, those are already challenges in the current system.
Right, and it's important to think about how these changes might exacerbate those existing inequalities.
Absolutely. We don't want to create a system where only the wealthy and healthy can afford quality care.
No, of course not. The goal is to improve healthcare for everyone.
Right. And I think it's important to acknowledge that there are different perspectives on how to achieve that goal.
Definitely.
This chapter lays out a very specific vision, but it's not the only vision out there.
Right, there are many different approaches to healthcare reform, and each one has its own set of pros and cons.
Exactly. So I think it's important to have these conversations to debate the merits of different approaches and ultimately to find solutions that work for the majority of Americans.
I agree. It's about finding common ground and working together to create a better system.
Right. And speaking of common ground, I think one area where there's likely to be a lot of disagreement is reproductive health care.
Oh, yeah, that's a big one.
Because this chapter makes it clear that they want to see significant restrictions on abortion access.
Yes, they do. That's a core part of their vision.
And that's an issue that people feel very strongly about on both sides.
Absolutely. It's a very emotional and deeply personal issue.
It is, and it's important to approach this conversation with sensitivity and respect for all viewpoints.
I agree. And I think it's also important to remember that there are real people's lives at stake.
Right, this isn't just an abstract policy debate. It's about women's access to health care and their right to make choices about their own bodies.
Exactly.
And I think it's also important to consider the potential consequences of these proposed restrictions. Like, what would it mean for women who live in rural areas or who can't afford to travel to another state to access abortion services?
Those are important questions to ask, and I think it's crucial to have a comprehensive understanding of the potential impact of these policies before making any decisions.
Absolutely. We need to make sure that we're not creating unintended consequences that harm the very people we're trying to help.
Right. It's about finding solutions that are both effective and compassionate.
Okay. And speaking of compassion, I think another big theme that emerged from this chapter is the emphasis on traditional family values.
Yeah, they definitely prioritize that.
And I think it's important to acknowledge that for many people, family is the foundation of their lives. It's where they find love and support and a sense of belonging.
Right. Family plays a crucial role in our society.
And I think it makes sense that we would want to create policies that support strong and healthy families.
Definitely, because strong families benefit everyone. They contribute to a stronger society as a whole.
Right. But I think it's also important to be mindful of the fact that not all families look the same.
Right.
Like, we live in a diverse society with many different types of families, and I think it's important that our policies reflect that diversity.
I agree. We need to make sure that our policies are inclusive and supportive of all families, regardless of their structure or composition.
Right, because at the end of the day, it's about creating a society where everyone feels valued and supported, where everyone has the opportunity to thrive.
Absolutely.
Okay, so we've talked about a lot of big ideas here, a lot of complex issues.
We have. It's been a deep dive.
It has. And I think it's safe to say that there's no easy answers when it comes to healthcare.
No, it's a complicated and constantly evolving field.
But I think it's important that we keep having these conversations, that we keep asking tough questions, and that we keep searching for solutions that work for everyone.
I agree, and I think this chapter, whether you agree with it or not, has certainly given us a lot to think about.
It has, and I hope it sparks some interesting conversations among our listeners.
Me too.
Because ultimately, the future of healthcare is something that we all have a stake in.
Absolutely.
So let's keep talking, let's keep learning, and let's keep working together to create a healthcare system that truly serves the needs of all Americans.
Well said.
All right. Thanks for joining us on this deep dive. It's been a pleasure exploring these ideas with you.
Likewise.
And to all our listeners out there, we'll see you on our next deep dive.